And finally on the program, the Lagos State government has flagged off the supplemental immunization activities at the Ifakoijai local government area. The exercise, which was carried out by Special Advisor on Mineral Resources, Mrs. Victoria Olowu, says vaccinations play a vital role in preventing health issues and also reflects the state government's commitment to elevating healthcare standards for its residents.
It's the official flag-off ceremony of the supplemental immunization activities at Ifakoijai local government area of Lagos. Nursing mothers bring their children for the vaccination exercise, and the pupils are also not left out.
You know, for example, yellow fever is a vaccine that, it goes even for the adults as well, up to 44 years old. So we are targeting, normally when we do immunization, we look out for the babies, but several of our adults who have not received yellow fever vaccines. And when it's time to travel or something, they ask you, where's your yellow fever card? So this is an opportunity. For our babies, we're immunizing against measles from 9 months to about 44 months for our babies. And of course, for HPV vaccine, we're making it available for young ladies young women from 9 to 14. And it's important to say that no one will be immunized without their consent. It is very, very important. So their consent forms, parents have to fill the consent forms for the children to say, yes, go ahead and get this vaccine. That's what we're doing in Lagos State. Primary health care focuses on promotion and prevention of diseases. And when we prevent these diseases, then our general hospitals, our tertiary centers will not be full of people who are sick. So that's why the primary care centers and the primary health system focuses on prevention and health promotion. And for the people who are worried about these vaccines, for example, HPV has been with us for so long that people actually pay at the private facilities for these vaccines. And what we're saying is that if there is no parental consent, no one will be immunized in Lagos State.
The campaign targets 3 major infections, including yellow fever, measles, and human papillomavirus, with a focus on specific age groups for each.
SIAs are conducted to a wider range of population of eligible persons to provide a rapid boosting of the community immunity and hence reduce the number of people susceptible to the targeted diseases with the goal of achieving their control or elimination. I hereby want to use this medium to reassure our people of the safety and efficacy of vaccines. We should all avoid rumors, misinformation, disinformation, and wrong perceptions about immunization, especially those making rounds on social media. Proper verifications should be made through credible channels such as qualified health workers, website of World Health Organization, UNICEF, etc.
UNICEF remains highly committed to supporting the government, healthcare providers, and communities to ensure that these life-saving vaccines reach every child, no matter where they live or what the challenges they may face. Our shared goal is simple but powerful. A shot to protect and safeguard our future from diseases that can be prevented is worth the shot. Together we can build trust in these vaccines, advocate for their acceptance, and ensure demand within our communities. As this campaign commences, we commend the leadership of the Lagos State government, led by the Lagos State Primary Health Care, the Ministry of Health, our dedicated health workers, community mobilizers, and all partners for their tireless efforts in making this initiative possible.
The state government encourages parents to take advantage of the exercise and keep their children safe.
Measles and yellow fever are highly contagious diseases that can spread rapidly, especially in densely populated areas like Lagos. And we know that there has been outbreaks of measles and yellow fever in the recent past, and people have lost their lives to these outbreaks. The consequences of an outbreak can be devastating, affecting most vulnerable members of our community, our children, the elderly, and those with compromised immune system. Hence, it is imperative that we take proactive measures to safeguard the health and well-being of our citizens. By launching a comprehensive and targeted reactive campaign across Lagos State, we can achieve several key objectives using this exercise. Number one is increased vaccine coverage, ensuring that a larger percentage of our population is protected against these vaccine-preventable diseases. Number two, public awareness and education. Through outreach programs like this, we can educate the community about the importance of vaccination and dispel any myths or misinformation concerning vaccination in our community.
The government has gone to a lot of effort and a lot of expense to make sure that these vaccines are available for you. It would be a shame for anyone to die of a vaccine-preventable disease or be maimed for life by a vaccine-preventable disease that was available on their doorstep. Please come out and take advantage of these vaccines. And if you have any doubts about any of the vaccines, please visit any of our health workers and seek whatever clarification that you need.
Representative of the First Lady of Lagos and the person of Special Advisor on Mineral Resources, Victoria Olowu, says the exercise is a reflection of the Lagos State government's commitment to elevating healthcare standards for its residents.
This vaccination we are embarking on is crucial for several reasons. Firstly, it ensures that our children are protected from measles, a highly contagious disease that can lead to several complications, including pneumonia, deafness, blindness, and even death. It is our collective duty not to allow any child to suffer from a preventable deadly diseases. Secondly, we are tackling yellow fever, a viral hemorrhagic disease that has caused great pain to many families. Considering the diversity, dynamism, and density of our population, we must embrace vaccination to protect ourselves against outbreak of this mosquito-borne illness that has the potential to cause several epidemics. Thirdly, through the HPV vaccine, we are taking a proactive deep step in the fight against cervical cancer, one of the leading causes of death among women in Nigeria. By vaccinating our young girls, we are not just protecting them from a virus, but we are safeguarding their futures, their dreams, and their potential to contribute to our society. This integrated campaign is not just about vaccines. It is about creating healthier communities and a healthier future for all of us.
The initiative aims to provide immunization services for ages ranging from 9 months to 44 years of age for yellow fever, 9 to 59 months for measles, and girls between the ages of 9 and 14 for HPV.